Before I introduce our guest speaker, reminder it's only Saturday? 2 weeks. 2 weeks, Saturday, for the Christmas Rolling Corridor and Festival of Lights Parade. If Mickey has some flyers, if anybody wants any of these, if you've got a business, please put them up. This one's going to be pretty special. There's a lot of surprises coming for this one, so I hope everybody shows up. Our speaker today is Dan Goetz, who is going to talk about the Affordable Care Act. The workings of it, not the politics of it. It's something that he's going to sit and talk to us about, and hopefully talk to some of the small business owners and how it affects them. All yours, Dan.
Thank you, Philip. My name is Daniel Goetz. I'm a certified Marketplace Navigator. I'm employed by the Alamo Area Council of Governments. I have my credentials here. The reason I'm pointing that out is there are many people coming forward representing themselves as something or somebody related to the Affordable Care Act. You may hear of a navigator assister. You may hear of an applications counselor. There are several entities which are in a similar capacity to me, Dan Goetz, but the only official navigators are the ones that are being funded by Health and Human Services through the federal marketplace. Those are the only official navigators in Texas. That having been said, there are also certified application counselors. I'm sure you're familiar with the AACOG Healthcare, which has a clinic here in Floresville. Perhaps it goes by the name of Floresville Clinic. The Floresville Clinic is part of a group, a large number of federally qualified health clinics that received their own grant. Not a grant to be a marketplace navigator, but a grant to be a certified application counselor. So if you're wanting to refer people for information, outreach, education, enrollment assistance, I have a flyer here with my contact information on it. I work out of San Antonio, and our particular organization serves 23 counties with navigation services, all the way from down in Tilden, McMullen County, all the way up north of Austin. So please stop by. I'll have these materials on the table. I have some applications. I have a list of the plans that are available in Wilson County. There's a lot of mystery as far as, well, what plans are out there. I suggest if you have a trusted insurance agent, broker, or representative that your family has worked with for some time, and don't hesitate to call that person, review these plans. These are the only plans that are under the Affordable Care Act. You may see a pickup truck. I saw one down, I'm right near the IRS building in San Antonio. You may see a pickup truck that says ObamaCare, lowest prices. Okay? That's not where you want to go. It might be a person selling what's called a mini med plan. It might be an indemnification plan, which pays a fixed amount of money for each trip to the hospital. So be very careful. These are the qualified health plans under the Affordable Care Act. I'm going to take you through a brief PowerPoint presentation. I can tell you right now that I will not talk about individual cases. One of the things regarding the navigation is this is strictly confidential. Just rest assured that the navigators with the Alamo Area Council of Governments are screened, background checked. They are trained under HIPAA. Information that goes to the exchange could be confidential, personally identifiable information pertaining to your health history pertaining to medications you use. Maybe it pertains to some of your tax returns. So navigators do not collect your personal information, but they may have a chance to see your information if they're assisting you to go to the website for your plan. Now, going to the website is only one of 4 options. I think what I'm going to do is go through the slides, because a lot of the points that I'm going to just talk about sporadically will be covered in the PowerPoint. So if you don't mind, I'm going to sit down and move ahead with this. I want to thank Philip. This is a very nice arrangement, and I want to thank you for having me here today.
Thank you for coming, appreciate it.
The Alamo Area Council of Governments, that's the area there. That's our 13 counties. Most recent, we picked up McMullen. And as I said, as far as the navigation project is concerned, we also have picked up 10 counties to the north of our region. Some things to know about the marketplace. It's easier to shop for health coverage. Streamlined application for an individual, for family. Phil wanted me to mention also the small employers. There is a facility called SHOP, which will be targeted for insurance plans for small employers. That facility is not open right now, but that's one of the platforms for enrolling in the Affordable Care Insurance. Most people will be able to get a break on costs. 90% of people who are currently uninsured will qualify for a discounted or free health insurance. This slide pertains to the exchanges that are going to cover the Medicaid people. As you know, Texas is not expanding the Medicaid program. The 90% is probably artificially high, because in Texas, there are individuals who would be covered by Medicaid had the program expanded. But I do want to say, as I've gone around to health fairs and talked to people, about 1/3 of the people who've come up to me, just from the general public, do not have insurance, or what they have is very minimal coverage. So there's great interest in affordable health insurance. The affordable health insurance plans cover 10 basic benefits. They all include ambulatory patient. This is walking in to see your doctor. Emergency, that speaks for itself. Hospitalization, maternity and newborn care, mental health services, including substance abuse and related disorders, including behavioral health. There's prescription medication benefits, rehabilitative, laboratory and clinical services, preventative wellness services, chronic disease management, and the pediatric services, which include oral and vision care. There are some oral and vision care benefits also for adults. These are enhanced plans. These are not the basic. The basic plans have to include all 10, but as far as adult vision and dental, that is an enhanced plan. This slide shows the 4 metal plans. There's actually a 5th plan, which is catastrophic. Catastrophic insurance is available for adults who are 30 years old and younger, and also for adults who cannot afford a metal plan. Metal plans being bronze, silver, gold, and platinum. You're probably familiar with insurance that's 80-20, 70-30, and so forth. The bronze plan has the lowest monthly premium. The insured is responsible for 40% of the cost. Silver is 30, gold is 20, platinum is 10. So as the patient pays less and less in terms of cost sharing, the premium goes up and up. These plans are targeted to everybody who does not have health care. The income level is actually 100% of federal poverty level. This slide was for states that were expanding Medicaid to 133. But here in Texas, the income range from 100 to 400% of federal poverty will allow you to go to the marketplace and apply for the tax credit payments toward your premium. So if you'd like to just have some numbers there, it's in terms of the household size and 100 to 400% of federal poverty level. It's folks within this range that ought to take a look at the marketplace to see what benefits there'll be for them. If your income is over 400% of federal poverty level, probably want to talk with your insurance agent directly, especially if you or a loved one in your family has a pre-existing or chronic condition or disability that would prevent them up until now from getting insurance. You definitely want to look at these plans. Even though you're outside the income limit for the marketplace, consider talking with your insurance agent. These same plans are available through reputable insurance agents selling qualified health plans. They're available at the same place, same price through that reputable agent as they would be if you got it through the marketplace. But I need to emphasize, to get the financial benefits on premium and cost sharing reductions, you need to go through the marketplace. I want to mention a little bit about the exemptions. As you know, the mandate for having insurance was upheld by the Supreme Court, and there are progressively increasing penalties from year to year for individuals that don't have a credible coverage and do not have some kind of an exemption from that penalty. Basically, for an individual, $95 a year or 1% of income, whichever is greater, would be the penalty for not having credible insurance, unless you have an exemption. And there's numbers of exemptions that, for the details, it'd be best if you called me to see how to qualify for an exemption from having to pay the penalty in the event you do not have qualifying insurance. I touched on this briefly here. The folks at 100%, we put a little arrow there because this slide pertains to states that would have their Medicaid all the way up to 133%. But here in Texas, the window goes from 100% to 400% of federal poverty. Folks below 100%, they may be eligible for Medicaid. If they're not eligible for Medicaid, then their options would be charity care, going to the emergency room, or perhaps going to the federally qualified clinic that they may be going to now. There's even a program called indigent care. In order to apply for one of these plans, and I do have a list of those available in Wilson County, well, in this case you need to live in Wilson County to apply for a plan available in Wilson County. Now, if you're lawfully present in the United States for the entire period for which the enrollment is sought, folks whose immigration status is such that they are here legally, they too can go to the marketplace. They could be here legally and maybe not even be eligible for Medicaid, but that is no barrier. Even though they are not eligible for Medicaid, if they're above the 100% of federal poverty level, they can go to the marketplace as long as they're here legally. And of course, folks that are incarcerated are not eligible for these plans.
They'll protest it.
If you are eligible for affordable insurance through your employer, you're not eligible. And one of the application's questions are that, what is your employment? Do you have insurance through your employer? So a determination of eligibility is made based on how you fill out the application. But if you say you have excellent insurance offered by your employer and that insurance is affordable, you will not be eligible for the marketplace.
Question.
Is it a personal question or a general question?
General question.
General?
How do you define affordable?
Define what?
How do you define affordable?
Affordable. It's approximately, there's two different measures. One is 8.5% of income, another is 9.5% of income. There's not consistency. I would like to talk with you privately to clarify which limit is considered affordable. Question about what is qualifying insurance, and this has been big on the news lately. If you remember, the administration said that you can keep your insurance if you're happy with it. And what happened? We all know that a lot of people that had plans that, for example, what they call these mini-med plans, the insurer knew that these plans were not creditable for 2014 coverage, so a lot of folks around the country received letters being told that they would have to be moved up into a more encompassing plan, pay a higher premium, or have their plans canceled. Some folks are grandfathered. That is, the plan that they had in March of 2010, when the law was enacted, that plan is grandfathered as long as there's no major changes. But going back three and a half years, there's not that many grandfathered plans. Latest thing from the administration is that folks that have plans that they'd like to keep, there's supposed to be some facility for companies to continue to offer those plans for another year. We haven't heard how that is taking place, but the administration has given that option to plans to extend those non-qualifying plans for another year.
That's what I just did yesterday. I extended mine another year. So, because it went from 3-something to 900. And so I called them and they said that I could, I said I want the exact same plan that I have now, same price, extended.
Yeah, I won't be able to talk on personal.
So, okay,
If you'd
so,
like
but
to
is
talk
that
to me
true?
separately about
But
that,
is
I
that
can't
true?
comment on that.
Okay, so-
That's between you and your insurer, and I don't see all the letters that come in the mail, so I don't know
Right,
what's going on there.
All right.
I do want to talk about Medicare. Who's heard of Social Security disability insurance? Okay. Social Security disability insurance is for people with qualifying Social Security records that they paid into the system, and due to a disability they're not able to work, they begin to receive what's called Social Security disability insurance payments. After 24 months, as in most cases, after 24 months, those folks then get their Medicare benefit. Even if they've not worked a full 10 years to get their full Medicare benefit, they will get a full Medicare benefit, including premium-free Part A. Anybody that has premium-free Part A, whether they're SSDI or they're the normal age 65 going into Medicare, if they have Medicare Part A premium-free, they are excluded from the marketplace. This has been a very big interest to a lot of people because folks that have their primary insurance through Medicare and a secondary insurance in the private market, they're finding the premiums for their secondary insurance going up $200, $250, $300, and individuals with disabilities that may pay for even $500 for supplemental insurance. You cannot simply drop your Medicare and expensive Medicare supplement and go to affordable care. That's a question that came up, but it's not an option. There are exemptions. I mentioned a couple as far as the person that is, a person incarcerated is exempt. A person for whom this insurance is not affordable is exempt. Members of a religion that's recognized as opposed to accepting health insurance benefit. That is a valid exemption from the penalty.
What's an example? What's related?
Muslim.
The information is available on the website, or I can speak with you individually. There are some individuals who are not lawfully present in the United States. They are not eligible. Members of an Indian tribe or eligible for services through an Indian healthcare provider or the Indian Health Service are not subject to the penalty. There's an organization I wasn't familiar with. It's called a Healthcare Sharing Ministry. This is, as I understand, a qualified group where the members simply pay for each other's health care. I hadn't heard of it before, but there are such organizations where the members simply pay in for each other's health care. They are excluded. They are exempt from the penalty from having to pay. We talked about the hardship. Oh, and another one, if the family's income is below the threshold necessary for filing federal income tax, if that's where you're at on your income, then you are exempt from paying the penalty. There are 2 cost-saving benefits. I have the table here for 100 to 400% of federal poverty. You're somewhere in this bracket, and you may want to pick this up, not for yourself and for a friend. Shows the household size. Anywhere between 100 and 400% of federal poverty qualifies for the tax credit. The tax credit, pull an example, let's say you complete your application and you're awarded a tax credit of $2,400. Well, they're not going to send you a check for $2,400. What they're going to do is let you shop for a plan, so your plan turns out to be $400 a month for the premium. What will happen is your $2,400 will be divided by 12 payments, which is $200 per payment. So your tax credit gets paid monthly to your insurance plan. The example I gave, your $400 minus your $200 tax credit, the balance for you to pay every month would be $200 to your insurance company. That's how the tax credit works. If you underestimate your income, you end up getting more income than you thought you would, well, that qualifies for a lower tax credit. You may have to pay back money to the IRS. So income is higher than what you estimated, and your tax credit is lower. It works the other way too. If your income turns out to be lower than what you estimated, you'll be getting a higher tax credit. When you file your income taxes, then you'll get a refund or a tax credit at the time you file your income tax. What I suggest to people is when they get an award that they're conservative. They don't apply the whole award to their premium because of fluctuating income. Maybe safest to apply a half or 3/4 of the award to the monthly premium and then settle up at the end of the year when you file your income tax. The other benefit is a cost-sharing reduction. Anywhere from 100 to 250% of federal poverty will give you the likelihood of receiving a cost-sharing reduction. What on earth is a cost-sharing reduction? Well, I mentioned on these metal plans, the silver plan is a 70-30. Silver plan, the plan will pay 70% and you pay 30%. If you qualify for a cost-sharing reduction, I've seen cost-sharing reductions all the way up to a 94% value, leaving you to only pay 6%. So if you have a plan where you're supposed to pay 30% and you qualify for this cost-sharing reduction, you may only have a 6% copayment. So when you're going to the doctor and you have trouble paying that co-insurance or out of pocket when you go to the doctor, the cost-sharing reduction is a very valuable benefit. But like I started to say on the tax credit, cost sharing is the same way. The only way to get these is to go through the marketplace, get your plan that way. An insurance agent, broker, salesperson will not be able to get you either the premium tax credit or the cost sharing reduction on your out-of-pockets. Now we talked about the penalty. The first year it's 1% of income or $95 per adult, increases to 2.5% of income or $695 per adult by 2016. So you can see what's happening here. The first year, a lot of folks may simply opt to pay the penalty. Maybe they haven't been to a doctor since they got their childhood vaccinations. They may opt to pay the penalty. But as time goes by, these penalties are going to get larger and larger. And folks that are going to begin to think, well, why should I pay such a large penalty? I could get a catastrophic plan perhaps for that same amount. So I think I'll just get the catastrophic plan and I'll have that in my pocket. Let's see how many more slides there are here. I think we're about done. Now the last couple of slides. This is our 210 number. Our toll-free number, I don't know if you're Metro out here or not, but we have a toll-free number for the folks that are Metro, which are not Metro, which is 800-960-5201. One of those last slides said that there are 4 ways, and this is, and if you're still rolling there, William, but this is Dan Goetz's experiences here. You've heard a lot about the 4 doors. Mailing in an application, calling in on the telephone to the marketplace, using the website, going on that way, or face-to-face with a counselor. Let me take those in order. We have seen the mail-in get bogged down. Experiences, people that have mailed in 4, 5, 6 weeks ago have no assurance that the paper application they mailed in actually has been entered into the marketplace. Okay? On the marketplace itself, very mixed results. I've talked to people that sailed right through the process Monday of this week. I talked to people that started in the first week of October and are stuck. They can't get through the process. As far as the calling in, that has been my most effective route to date. And I've been advising my clients and families to go ahead and take one of these paper applications, get all the information put in there, and then get back with me. Together, we'll go ahead and call the marketplace. Now, if you've done that work, you filled out the paper, you can call the marketplace yourself and enroll. But sometimes the agents of the marketplace are kind of frank and brusque, and they ask you a question, and they won't rephrase the question. They'll say the same question over and over. So if you don't quite know what they're getting at, you maybe have a little trouble. So I enjoy working with people kind of in a 3-way call where they're working directly with that agent over the telephone, but I'm helping maybe a little kibitzing if there's especially if there's a communication barrier, or the applicant takes a little more time to understand what's going on. As far as the in-person, as far as going into the office, I mentioned the Floresville Clinic. Sure, you can go into the office, but the thing with the Floresville Clinic, they're pretty well limited to the same constraints that the rest of us are. They're not going to have any more luck mailing in your application. They won't have any more luck on the internet itself unless it happens to be a good day. It's funny, Monday was a good day, but now today, here people are having problems with it, so it's kind of on and off. As a navigator, what I'm really looking forward to is the first week in December for a couple of reasons. We're going to be, Melanie, I was going to see Melanie here, she's obviously not here. Melanie Trevino over at the Alamo Community College Grand Extension. What do you call your school here? The Alamo Community... Alamo Colleges at the high school will have an enrollment event on Thursday, December 5th. They have almost 30 computers which work very well with the internet. Part of the problem with the Marketplace website is the technology of the website itself, but the other problem is it may not be compatible with your computer. You could have some issues with your personal computer that's limiting you from completing an application. The Alamo College, like I said, has an amazing lab. Ms. Trevino is making that available the night of Thursday, December 5th. We'll be wanting to get the word out on that to the community. But the other reason we're excited about it is, and I get this from my children, I tell my children what I'm doing, they say, oh, Daddy, nobody fills out paper applications, nobody calls up on the telephone. If it's not working correctly on the computer, you won't have anybody under the age of 35 messing with it. So I'm very excited that when we go over to the college on December 5th, not only will we have smooth sailing with their computers, we have promises, right? We've all heard November is going to get this all straightened out. So we'll have smooth sailing with the computers, and we'll hopefully get some younger folks, because what's really going to be key to the success of the Affordable Care Act is broadening the base and having as many youngsters enrolling as possible. And if there are questions of a general nature, I'd be happy to speak with you. If you'd instead rather grab some information here and give me a call, I'd be fine with that too.
I have a question.
Yes.
If I need to do this, which I don't, do I have to pay you for your services?
No, very good question. The lady asked if there's any payment to me for my services. No. That's another, I think, hold on. Another thing to watch for,
Put that in the article.
if a counselor or an agent is charging you a fee for these services, head the other way. Yeah, it's probably somebody who's selling insurance perhaps for their brother-in-law or trying to move them toward one plan or another. Just go the other way.
And the people who sign up for this, how do they pay their premium? Do they have to have a bank account, or can they, how does that work?
The way the handoff is this. After the application is completed on the internet, the applicant is responded, they're told to say, okay, you are eligible to go to the marketplace. There's no reason, there's no reason to keep you out of the marketplace. Go to the marketplace and pick out a plan. Here's your tax credit, if you're eligible for one. Here's your cost sharing reduction, if you're eligible for that. When you go into the marketplace then, all of the plans that you're eligible for come up. The reason it's important to have this list here, and I'll get around to your question in a minute. The reason important is to have this list is you might have 30, 40, 50 plans in your county. You want to be sure which plan you want. So when you go shopping for it, you press the button and it says enroll. Okay? At that point, the plan takes over. And you have a window of time. You have about 2 weeks. I'll use this example. We're being told that up until December 14th and December 15th, you can still close on a plan at the marketplace and have that start on January 1st. The insurance companies have asked for about a 15-day window to collect your premium and get you started. So a very important date again, that weekend, December 14th, 15th, that's going to be the last time to enroll and still be able to start your insurance by January 1st. Before you can start, you actually have to be enrolled, you have to make that first payment to the insurance company. You don't pay the agent, you don't pay the marketplace, you don't give out any credit card numbers or any information like that. Once again, run the other way. If somebody's looking for your credit card account or they want you to write a check, run the other way. It doesn't work that way. Your contract, the services to be provided to you by the insurance company, that's a contract between you and the insurance company. That's who you pay. Whatever their arrangements are, check, credit card, cash, the navigators have nothing to do with that. The marketplace has nothing to do with it.
What about as a business, do we have to do anything for our employees? They're all part-time, but do they have to sign a letter denying?
I was hoping, and I mentioned this to Philip, I wanted to bring at least some flyers along for the question this lady is asking. You have one? Please give me a call so I get your contact information. I have a whole different presentation for the small business owners, a whole different presentation. I was hoping just to bring the handouts, but I didn't even have time to print them. That's a whole separate issue.
But just quickly, I mean, is there a form that I need to have them sign? Because they're all part-time employees. Do I have like a window of time that I have to do that, or do I don't have to worry about it?
If they don't have insurance, they will be penalized. They'll have to, if they don't have insurance, they'll have to pay a penalty.
Right.
If the insurance is from you or from wherever they get it, your employees will have, there's nothing for signing.
Okay.
If they don't have, qualifying affordable insurance through their employer or through their spouse's insurance, whatever, they're subject to the penalty unless they have an exemption. Small businesses, I will say this, there are incentives for small businesses to have group insurance. So it's kind of a carrot and a stick. They're holding the stick up. And of course, employers, as you know, are gonna have to pay a penalty further on down the road if they aren't offering group insurance. That's coming later. Remember, that was put off, the administration put it off for a year for large employers. But there are incentives for smaller employers to offer group insurance. There's some very good tax credits for those businesses.
In general, do you have any idea how much that penalty is?
For the businesses, I've heard two different figures. Has anybody heard, okay, off the record, anybody heard like $2,000 per employee? Has anybody heard that? Okay. Once again, I've got to see the numbers. It would make sense to me that the penalty would be about $1,200, because $1,200, you can kind of stick that in your brain. Those of us that have insurance, okay, part of the reason our premiums are so high, part of the reason our healthcare bills are so high, is each person that uses healthcare services in this country that doesn't have insurance is getting a subsidy of approximately $1,200 per year, paid by the rest of us through the higher premiums that we have and also the higher bills we pay our doctors and hospitals. $1,200 per year is what that uninsured service is worth. Logically, in my mind, there's a dog or something. Logically, in my mind, it kind of makes sense that if I have 10 employees and I'm not insuring them, well, the burden of each of those employees is something like $1,200 a year. But the penalty, I've heard, is quite a bit higher. And until I get my presentation together, I don't want to, please don't quote me on that.
No, that's in general.
And the website for the small businesses is not working. That was one of the first places I went, and they're trying to get the individual family website working, and then there will be a website for small businesses.
I have a question.
Yes, sir.
Can you bring us up to date on Medicaid and why so many people are going on and getting Medicaid?
Okay, the question has to do with Medicaid. Why are so many people going on and getting Medicaid? In Texas, if you have $1 of Social Security income, that's SSI, if you have $1, you are eligible for full Medicaid. Okay? Now, how do you get SSI? Okay, you have to be disabled, and you have to have an income which is below the SSI limit of $210. You have SSI, you're entitled to full Medicaid.
If you have SSI, that's in general a certain amount in that.
It's $1, that's all it takes.
$1 is all.
If you have an income
But
of,
why would I want Medicaid? If I'm on Medicare.
okay, the question is, why would an individual on Medicare want Medicaid? There are,
And I what I already have, which is SSI.
There you go.
why would a person on Medicare want Medicaid? There are folks who have Medicaid on account of the SSI. This is full Medicaid. Different kinds of Medicaid, but let's say full Medicaid. And they reach Medicare age, and perhaps they're dependent on somebody, they have access to some Social Security account that entitles them to Medicare. They're what you call a dual eligible. They're eligible for Medicaid, they're eligible for Medicare. My scribe back here, that's an MQMB. MQMB, that individual is dually eligible for Medicare and Medicaid. They also have access to some amazing health plans through Medicare Advantage, which takes care of major dental, among other things. Any other questions of a general nature? I do have some materials here which I will leave for a little while. Mark your calendars if you know some folks who would like to try hands-on over that amazing computer lab with Melanie. Just kind of save that date, Thursday night, December 5th. Sure we'll be getting some word out to the community and giving that a try. Thank you.
Thank you.
Thank you, Phil.
Thank you. I just signed